Welcome back to the Gum Guru Podcast, where we talk about more than just your gums, because a healthy mouth also means a confident smile, too. I'm your host, Lisa Bruff, and today we're diving into a question we get all the time. Is teeth whitening safe? From drugstore whitening strips to professional treatments, we're breaking down what works, what doesn't, and what might be doing more harm than good. Dr. Macon Singletary of North Raleigh Periodontics and Implant Center is here to help us separate whitening facts from fiction and tell us how to brighten our smiles without irritating our gums. So good to see you again today. How are you today,
Doing
Dr.
great, Lisa.
Good. So this is a big one. All us ladies really want to know. We love our teeth white. I don't know. I've met some people where they open up their mouth and like you have to put on sunglasses. They've just whitened so much.
Right.
It's almost frightening. But is it safe? Is whitening safe, and what should people know before they do it?
Yeah, good question. And to unwrap this, you got to think about genetics more than anything. So skin color, hair color, teeth color. It's all genetically determined. Everybody's different. There's the color of your hair, skin, and teeth. It's the ectoderm. Is going to be different than mine. And so, beauty's in the eye of the beholder. We all want that movie star smile, but that's not necessarily perfect for you or appropriate for you. Now, I have people come in and say, I want my teeth whitened. And I'm going, why? I mean, it blends, it looks good. You don't want somebody staring at your teeth. You want them to look at your face, your eyes, Right. If you smile like you're saying, this Cheshire cat grins, it's sort of disconcerting. It can be a little bit too much. But I used to not recommend whitening, but I've changed my stance on it because, I do think that there are brands or products that are safe that you can do, but the individual needs to understand that it's not permanent. And if you keep doing it, it is going to change the enamel structure, the mineral composition of your teeth. And over time, it could affect the composition, affect the integrity, and make them more brittle, susceptible to decay, and just some people even make the teeth translucent,
Yeah, I see that. Some people don't. You could almost like see through the teeth.
Right.
Is that from too much whitening sometimes?
Yeah, and that's when they use a light to cure to oxidize the enamel matrix. To take the dye or the color in the melanin that's in the tooth structure and the hydroxyl apatite, and bleach it basically.
Wow. So it's like literally getting into the tooth, not just kind of whitening the surface.
Right. Mm-hmm.
It's actually going inside of the tooth. That doesn't necessarily sound healthy.
Well, and two, there are certain factors that determine the efficacy of all that. If you've had a history of fever, when you were young, and the enamel maturation is a little bit different during that time, the tooth being developed, it may not have the same composition of the rest of your teeth, and you start whitening, you're going to start getting a streaky appearance rather than not a uniform look. And you see, people need to be aware of it, like tetracycline staining. When people take an antibiotic.
Right, I remember hearing about that when I was young. If you took tetracycline, people had like staining on their teeth or striping on their teeth, or.
Yeah. I'm a late '60s, '70s guys, and we used to have black lights. People that had tetracycline stained, they smile and the teeth would glow.
That's wild.
It's the double bonds in the tetracycline. It absorbs the UV light and it makes it glow.
Yeah, something you could do to impress people at the party.
Yeah, that's right.
So there's so many options out there, from charcoal toothpaste and the light up kits you were talking about. What's the most your take on the most common over the counter ones?
Well, the charcoal has not been tried and true. I'm not necessarily. I wouldn't recommend that, but The difference between an in-house treatment and ones you get over the counter is that the in-house is going to be more accurate and is going to take into account gingival sensitivity. The in-house may be more efficient and get a result quicker. Quicker is not necessarily good, as far as I'm concerned, because hydrogen peroxide is what they use, and carbamide is another product, which breaks down into urea and hydrogen peroxide, but it's a little bit slower. And I use that product. That's a product I recommend in my office that that I've tried on myself, and it's 11, 16, 22% concentration. And we use trays, and 2 or 3 minutes a night, you put the gel in, and you can slowly get to the color that you want, the whitenings you want.
How long does that take? Like, you take the trays home, and how long does that usually take?
I tell patients to 5 or 10 minutes, maybe 2 or 3 nights in a row, and achieves what you want. And this product doesn't irritate the gums.
Okay, because that's the other thing I was going to ask, is like, because you don't want to do something that's going to cause you problems down the line.
Right.
Are there some things over the counter or some things people are using that do cause problems with the gums?
Well, you could, the strips that you get, over the counter can slip and irritate the gums, and that's another thing to be aware of. I mean, you kind of look at the forest for the trees. If you have periodontal disease, you have inflammation, you got inflammatory gum disease, and you want your teeth white, what do you do first? You can't get the cart before the horse.
So you shouldn't do them together.
Well, you should get your gingival tissue healthy first. And so, a dentist, periodontist would tell you, oh, yeah, your gums are healthy. I had an individual in the other day, wanted, aesthetic crown lengthening and whitening, and she had plaque all over the place, and she has inflammation. And I said, before we can do anything, we got to get the inflammation under control, because the whitening agents can irritate the gums and cause inflammation. So you want to get the gums healthy first.
You would say that maybe sometimes they could break down the enamel on the teeth too. Is there something that can help? There might be people out there who have overused the whitening strips or whatever, and they're having some tooth sensitivity and all. And is there some way that they can restore the enamel, or help help that sensitivity? Yes.
Fluoride. I mean, some people don't like fluoride, but potassium nitrate's good for that. But there's 3 levels the effect of fluoride. Level 1's in toothpaste. It leaches in, leaches out. Then there's the varnish, which you paint on. And then there's fluoride paste and trays, MI paste. Now, people, and for extreme sensitivity. And there are products that you can put on the tooth structure if there's a particularly sensitive area. But generalized sensitivity from whitening is, a varnish is something that can be done. It's painted on. It's safe. There's an MI paste that we put in trays. And I usually use that for patients that have had head and neck cancer and the salivary glands aren't working at all, and they have an increased rate of decay. And so it's a way of help hardening the tooth structures, and as well as helping with sensitivity.
What about, I'm a TikTok expert, so what about hydroxyapatite? That's the big fancy TikTok one. Is that the
good.
one?
Yeah,
that works good. Also to put it on there.
Yeah.
And when you're whitening, should you drink wine during that time when you're doing the whitening treatments over a few days? Should you be drinking wine or coffee much?
Water, but
Will it hurt the teeth when they're being stripped of enamel to be doing more acidic things?
Well, you got to be careful of that, because over time it can absorb into. That's why you have to repeat it. Because wine, tea, coffee. I'm a coffee drinker, and I haven't done it in a while. But if I'm going to a meeting and I don't want to look like my teeth have been put in a can of tobacco juice or something, I'll do some whitening with my trays, but.
So, how about implants? People with implants, can implants be whitened, or should people with implants whiten?
So that's another thing that you got to be aware of. If you're going to do whitening, restorations that are already there, they won't change. So the color you have with the implants will be the color you have the rest of your life. So if you're going to have crowns or restorative therapy done that involve covering, like veneers, covering the tooth structure itself, you need to be aware of, okay, am I going to be doing whitening? And if I am, how is it going to affect what I do?
Yeah, you don't want to look like that two color kernel corn,
Yes, that's right.
Okay, that's good to know, right? Because they are going to change. So what's your advice for someone who wants a brighter smile, but they really want to protect their oral health long term?
Yeah, I just, ask your dentist, and make sure you're periodontally healthy. Make sure, with your dental history that there's nothing there that in your past that could have affected the enamel maturation. dental hypoplastic, orthodontic therapy, where there's been mineral demineralization of the tooth structure, little white patches. Bleaching is not going to necessarily get rid of those areas of this spotting or blotching that you may see on teeth. And so veneers may be a way to go there. Bleaching won't do that. So the dentist can direct you, would whitening be a good thing for you or not.
It's good to know. Wow, we got a lot of information today about another beauty product, another beauty thing with teeth. Okay, so what's our homework?
Well, I mean, if you really truly want to have a different look, it's the over-counter products probably won't be as effective, and then can be have a varying result. So you want to talk to your dentist and say, what can I do? What's the most efficient way that won't irritate my gums? And there are products out there that are more aggressive that can be more irritating. The less aggressive ones are the ones you probably want to go to.
Okay, so whitening your teeth shouldn't mean weakening your smile. And whether you're prepping for a special event or you just want to feel more confident, the right approach makes all the difference. Big thanks to Dr. Singletary for giving us the inside scoop, because sometimes the best way to brighten your smile is to start with expert advice. Right? Want to explore safe professional whitening options? Visit northraleigh.perio.com and schedule a consultation. And as always, keep smiling and keep listening to the Gum Guru podcast.